Hi, I'm Dr. Bruce Bonn. I am a minimally invasive gynecologic surgeon in Washington, D.C. I specialize in Da Vinci robotic hysterectomy, myomectomy or removal of fibroids, and removal of complex ovarian cysts. What is an oophorectomy? Removal of an ovary is oophorectomy. If you are considering a hysterectomy, you will be faced with the decision of whether your ovaries should be removed or not. Well, let's first clarify the correct naming of these procedures. Patients often talk about a complete versus partial hysterectomy, but these are not accepted medical terms and can lead to confusion when talking to your doctor. Hysterectomy refers to removal of the uterus only. Complete removal of the GYN pelvic organs, the uterus, tubes, and ovaries is a hysterectomy with bilateral salpingo-oophorectomy, abbreviated as BSO. How do I know if I should have my ovaries removed with my hysterectomy? Ovaries are not routinely removed in a premenopausal woman if they are normal in appearance. Doing so would put the woman in immediate surgical menopause, where the abrupt drop in estrogen levels can result in severe symptoms. An ovary would be removed if there is a suspicion of an ovarian cancer. You and your doctor may decide on removing one or both ovaries if there is known or suspected ovarian abnormality, such as endometriosis, an ovarian cyst, or you are at increased risk of ovarian cancer. I was trained to routinely remove the ovaries in postmenopausal women undergoing hysterectomy. Doing so dramatically decreases, but does not completely eliminate the chance of ovarian cancer in the future. And up to 3% of postmenopausal women who keep their ovaries may need surgery in the future to remove them because of cyst or pain. But we now know that postmenopausal ovaries continue to produce significant amounts of androgens, which may be beneficial for your bones and sexual function. Definitely discuss this with your doctor. I have an ovarian cyst. Is there treatment needed? If an ovarian cyst is found on physical exam or sonogram, and the patient has no symptoms, and all the tests performed are consistent with a benign process, there is no suspicion for a cancer. Would I remove the cyst? Probably not, but I would certainly follow the cyst over time with pelvic exams and sonograms. CA-125 blood test would also be followed in postmenopausal women. Development of any symptoms in the patient or any change in the cyst, including size or appearance, would dictate reevaluation of whether surgery was indicated. Of course, the care of each and every patient must be individualized based on her specific presentation. Is there a non-surgical treatment for painful ovarian cysts? Rupture of a simple ovarian cyst is a common occurrence in women of reproductive age. If a woman is hemodynamically stable and other causes of abdominal pain, including tubal pregnancy, are ruled out, this is usually treated with a conservative, non-surgical approach. Pain medication can be prescribed. Symptoms typically resolve in a few days. Birth control pills are frequently given to help prevent future recurrence of cyst rupture. Surgery is more frequently indicated if the painful ovarian cyst is secondary to an endometrioma, twisting of the ovary, or there is blood in the abdomen after rupture of a simple cyst. Unfortunately, not all ovarian cysts are benign. Ovarian cancer is the second most common gynecologic malignancy and the most common cause of gynecologic cancer deaths in the United States. My mother died of ovarian cancer. Should I have my ovaries removed? Approximately 10% of ovarian cancers are associated with inherited BRCA1 and 2 gene mutations. If you inherited this mutation from your mom, you have an approximate 40% chance of developing ovarian cancer by the age of 70. This is in comparison to less than 2% lifetime chance of ovarian cancer in the general population. If you are BRCA positive, strong consideration should be given to remove your tubes and ovaries after you complete childbearing. The majority of ovarian cancers seen are not associated with the BRCA mutation. Even if you do not have this mutation, you may still be at increased risk of developing ovarian cancer if your mother, sister, or daughter has or had ovarian cancer. Prophylactic removal of the tubes and ovaries are not routinely recommended, but you may have a lower threshold for deciding to remove the tubes and ovaries if you need hysterectomy. There is no screening for ovarian cancer that has been proven to decrease the death rate from this disease, but do talk to your doctor about available ovarian cancer screening. Oral contraceptive use has been consistently found to be associated with a reduced risk of ovarian cancer. Studies have shown that the longer a woman used oral contraceptives, the more her risk of ovarian cancer decreased. The risk decreased by 10 to 12% after 1 year of use, and by approximately 50% after 5 years of use.